In medical tourism, everyone is fighting for the patient's attention, but your biggest marketing issues aren't marketing issues. They are trust issues in disguise. While you focus on conversions, North American patients especially fixate on trust above all else, even cost. The key to earning that trust isn't in a marketing playbook. It's found through a nursing-informed clinical lens. We'll show you why a nurse's perspective is your most powerful authority-building tool in medical tourism. Marketers see a funnel: awareness, interest, decision. They build beautiful websites showing modern facilities and run ads. But the international patient is on a trust journey. So what signals are they actually looking for to feel safe? Patients look for signs that someone is anticipating problems, managing risk, and guiding them through uncertainty. Interestingly, these are the same qualities people associate with the profession they trust most: nursing. A clinical trust lens applies the principles that make nursing trusted to how organizations communicate with North American patients. Marketing focuses on attraction, whereas a clinical trust lens focuses on reassurance. Marketers address analytical risk. We have a 99% success rate, but patients feel emotional risk. Will they care for me if something goes wrong? Nursing leadership changes how you interpret patient hesitation. What marketers often call a conversion problem is frequently an unresolved safety concern. A nursing-informed clinical perspective shifts the focus from promotion to reassurance, because patients evaluate whether the organization feels safe, coordinated, and prepared. Marketers promise outcomes: a perfect smile. In contrast, a nursing perspective explains the process. Here's our 5-step safety protocol. Process earns trust. So the nursing-informed clinical lens shifts your goal from persuading the North American patient to reassuring them. This is a fundamental change in communication. This is how a nursing-informed trust strategy changes patient-facing communication. Most medical tourism marketing emphasizes facilities, pricing, and outcomes. A nursing-informed strategy explains continuity of care, post-operative communication, recovery planning, escalation protocols, and patient support systems. One approach markets treatment. The other reduces uncertainty, a marker of safety. And patients trust the provider that makes them feel safest navigating the entire experience. So instead of, or in addition to, patient before and afters, post a Meet the Nurse series. Instead of a price ad, explain your pre-travel preparations. Does this mean traditional marketing is useless? Not at all. But its role changes dramatically. Authority in medical tourism comes from reducing uncertainty before comparison begins, not from louder promotional messaging. This is especially true in North America. This is why a nursing-informed perspective matters. Patients evaluate responsiveness, coordination, communication, and reassurance long before they evaluate surgery itself. Real authority is built by teaching and demonstrating how you mitigate risk, answering the questions that keep patients awake at night. This approach is not about showcasing staff. It is about structuring communication around the emotional and operational concerns international patients actually carry. So, let's connect all these ideas. How does this nursing-informed clinical lens solve the original problem? We started with the idea that marketing problems in medical tourism are trust problems. We learned that patients assess risk emotionally, asking, "Am I safe with these people?" Using a nursing-informed communication strategy doesn't just sell a service. It directly answers that emotional risk question with people and processes. The goal is not greater visibility alone. The goal is reducing uncertainty before a patient ever compares providers. In a market where everyone claims to be the best, being the most trustworthy is the ultimate differentiator. This is how you build real authority. Building genuine authority isn't about bigger marketing budgets. It's a shift in perspective from seller to caregiver, from marketer to patient advocate. Your strongest asset is not your technology or your price. It's your ability to build confidence through the lens of those who deliver care every day. After all this, look at your marketing. Does it answer a marketer's questions, or the questions a patient is afraid to ask? Who is the hero of your story? It's time to stop trying to solve marketing problems. Start solving trust problems. That is the path to authority.